Hey, what's up guys? Welcome back to the nursing channel. So on today's video, I'm going to answer Julie Bonner's question. And Julie Bonner is one of my subscribers who commented the question, is utilization review difficult? Because she works in case management and she does discharge planning. And for those who don't know, the case management department is split into two sections. So you can either do discharge planning or you can do what's called a utilization review, okay? And so she's interested in jumping over to the utilization review side of case management. And she's asking, is it difficult? Now, the answer to that question is, it is not difficult. In comparison to discharge planning, I personally feel like it's easier, okay? And utilization review is a good career choice for those who are looking for a structured schedule with no surprises. Like, you know, when you do utilization review, you know what to expect the next day. You're not going to get any surprises like doing bedside care where somebody, happens to get into cardiac arrest and now you have a cold blue, or in discharge planning where there's lack of communication and then the patient's discharge becomes delayed for some reason. So an utilization review is nice because you don't really experience any of those issues. You're basically just going to be looking at patient charts and reviewing all the progress notes, reviewing the patient's vital signs, lab values, and the medications that they're scheduled on, and trying to determine if there is medical necessity for the patient to remain in the hospital. That's essentially what a utilization review nurse does. And then once the utilization review nurse determines that there is medical necessity for the patient to remain in the hospital, in a hospital bed, then they communicate that information over to the patient's insurance. And usually what happens is the utilization review nurse will fax over clinical information to the insurance. And then also what a utilization review nurse does is a utilization review nurse determines whether a patient has medical necessity to remain in the hospital by using a tool called InterQual. And InterQual is a set of guidelines that will guide you in determining whether the patient should remain in the hospital. And so just to focus on Julie Bonner's question, is utilization review difficult? No, I do not think it is difficult. Actually, a lot of people that have gone into the utilization review department with no experience say that it could be monotonous and tedious, but I've never heard anybody say that it's difficult or they're leaving the department because it's hard and they don't understand. Usually people just leave the department because they just feel like it gets tedious because you're essentially, it's basically a desk job. There's very little patient interaction. You're primarily going to be talking with like physicians every now and then, just to get orders changed. But other than that, I mean, you're fixed to your desk and your computer. So if that's something that you're looking forward to, you're looking for a job that stress levels are lower, then I would recommend becoming a utilization review nurse. And I just want to clarify things. Just because it is an easier job, this job is still a very important job, because your clinical reviews are necessary, because without them, without you communicating with the patient's insurance, the hospital is not going to get reimbursed for the medical services that are being provided to the patient. Oftentimes, when the patient's insurance doesn't receive these clinical reviews and clinical information, they will deny the patient's hospital stay, meaning they won't pay the hospital for the services that were provided to the patient. So anyways, this is just a quick response to her question. I hope this answer helps you guys out. Like this video and subscribe to this channel if you found this video helpful. I'll see you guys later.